Thank you, everybody, for coming tonight. And I don't know why right now I'm not.
Tim disappeared, but I just admitted him.
Oh, he somehow got out by mistake? Okay. Yep, I think I hit the wrong thing. I hit the meeting, leave the meeting, sorry. All right, I'm back. Sorry. Very good. I want to thank everyone for coming tonight. I really appreciate it. And it was a beautiful day today, outdoors. What I'd like to ask, at the last meeting, I signed the mission statement, the vision statement for RICDHH and the guiding principles. And I did it in American Sign Language. But this meeting, I would like to hand that off to somebody else so that each commissioner has the opportunity to read it for themselves. And obviously all of us are on the board, so that gives us an opportunity. And I'd like to know, Brett, your video is on. So I thought I'd take advantage and ask you if you want to read the screen. What I'll do is I'll bring it up and you can read it if you're willing to. Brett, would you read the vision, the mission, and the guiding principles if we show it on a slide on the screen?
Sure.
Great, thank you so much. The next meeting, it'll be somebody else, so you'll be off the hook. Okay.
You want me to...
Bethany can share it, and that way you'll be able to see it.
Is this from the agenda?
I think it's on the website.
Okay.
What I'm going to do is I'm going to put the link on it. Yeah, no, that's it's the missioning vision. He's going to put the link, he's saying. I have it right here.
Is it in the commissioner's packet?
And Brett, he's not looking at you right the moment, so.
Guiding principles, you said? I can pull that up right now. Mm-hmm.
Yes.
One moment, please.
I just shared it on the website too. I just put it down in the chat, but great, thank you. Okay, so yes. So the mission, the vision, and the guiding principles, and Brett is going to read them.
Oh, okay, give me just a moment, please, because I need to pin the interpreter. One moment.
Okay.
Go ahead, Brett.
All right. I have it on my screen up here too, so just quickly. The mission statement of the Rhode Island Commission for the Deaf and Hard of Hearing is to provide innovative leadership in public policy, advocacy, service delivery, and accessibility throughout the Ocean State. The RICDHH ensures opportunities for every deaf, blind, and hard of hearing person to become an empowered and contributing Rhode Island citizen. Our vision is that we aspire to be recognized as essential resources and advocate for the deaf, blind, and hard of hearing citizens in Rhode Island. And then lastly, our guiding principles are communication, opportunity, and equality. For communication, We want to ensure that all Rhode Island deaf and hard of hearing citizens have full access to public audio and visual information and communication through sign language interpreter services, captioning, and technology. Opportunity. This means to create new opportunities through advocacy, policy, education, employment, and legislation for all Rhode Island deaf and hard of hearing citizens. Lastly, equality. To promote equality in the community and society for all Rhode Island deaf and hard of hearing citizens. Thank you.
Thank you, Brett.
Thank you.
Very good. Thank you. We'll pick someone next meeting as well. I want to get in the habit of reading it at the beginning of each meeting, so people have it fresh in their minds, what our purpose is each time. Thank you. So I actually was on the second item in the agenda. The first one is the roll call. So I'm going to backtrack now and do roll call. Obviously, I'm here as the chairperson. I see Betsy Beach, secretary. Hi, Betsy. Brett Hayes, who just read. Carolyn, you just opened your screen, so I'll introduce you. Carolyn Obrecht, one of the commissioners and the vice chair of the commission, the board. Brett Hayes, who just read the statements, he's the treasurer. Kimmy Marthers. Hi, Kimmy. Tina Nelson. Hello, Tina. Let me think. Okay, we have Drew Balsley. Hi, Drew. We also have staff attending tonight from the commission's office. Bethany Link is here. Hi, Bethany. She'll be helping to host this meeting and moderate it. We have Ernest Covington III, who's the executive director of the commission's office. Thank you, Ernest. The interpreters are working the meeting. And we have Christine West. Yes, hi, Christine. Also, Mike and, Mike Bear. He's here as a staff person, and also Lindsay Conway. She is also here. So those are the staff that are present tonight. Oh, Holly, you didn't get mentioned. Oh, hi, Holly St. Pierre. Hi. Great. Thank you, everyone, for coming tonight. I appreciate you showing up. I'm just looking at the next item. We did the introductions. The agenda specifically says that, and I'm not sure, it looks like there was a change from when we put it together. I'm going to proceed though. Ernest, if you look at number 3, it looks like there was a change from what we discussed. This says for each commissioner to talk about, we're talking about Paul Malloy, to do a remembrance of him as he passed away last month, and for the commissioners to make a statement. We'd like to have an opportunity for people who knew him to make a statement about him, a remembrance about his impact on the deaf community in Rhode Island, his service on the commission, what he did for deaf, blind, hard of hearing citizens throughout the community. And we want to give an opportunity for that. When I first met Paul, I had come to the commission to interview at the time. And I remember there were a group of people, asking me questions. And I remember everybody taking turns talking to me, and then Paul. And he asked his question was related to different groups like deaf, deafblind, hard of hearing, late deafened, different groups within the deaf community, and what are the core values within each group. And I remember him asking, what are some of the basic similarities in those groups and what are the differences in their needs? And I remember the reaction when he asked that question, I answered and then he nodded. And after that, I joined the commission, and I always remembered that. I felt like after a period of time, he had stepped out after I served for a year. But then we invited Paul to be involved in a panel at Brown University where I was working. And he made some comments about his perspective and his experience. And everyone was so impressed with his remarks. He had been so active and advocating for people, working on people's needs. And he had been the director of Corliss Center in Warren. And I would like other commissioners here tonight, if you feel you'd like to make a comment or remembrance about him, I'd like to hear it. We're going to switch interpreters.
I'll just say that I joined the commission in 2011. He was there I think about the same time that I was. When I started, he was there for 2 or 3 years with us. And I was impressed. He knew exactly what he himself needed for access and helped to arrange it. He's very good at advocating for himself and the group of deaf blind people. And he brought with him experiences from around the country. It was obvious that he had talked to many people in many places and was an amazing resource. And not only that, he had a great sense of humor. He was very enjoyable to be around. And I just am so appreciative that I got to spend a couple of years with him.
Great, thank you. Other commissioners want to share their reflections or thoughts around Paul? Anyone? Any takers? Right, yes, go ahead.
I never really got the pleasure to know Paul, but I did get to know his wife, Marjorie, through working with the Ocean State Center for Independent Living, and she was a big advocate for the deaf and hard of hearing community through that agency. And I think it just spoke volumes about how they, as a family, really advocated for the entire community. So just through her alone, it helped me understand the full impact he had as well through the community. So sorry to hear for the community loss, and hopefully going forward, we can continue to support the mission in his honor. Thank you.
Thank you, Brett. Any others? Anyone else want to comment? Ernest? Hi, everyone. Unfortunately, I didn't have the opportunity to meet Paul, but I did meet his wife. And I can see Paul has made a big difference in Rhode Island in terms of him running the Corliss Center And I really feel like he does deserve that honor. But sadly, I didn't get a chance to meet him. But his spirit, his experience, his passion was just very evident. And we want to continue to honor him and honor that spirit that he carried. And this is Tim speaking. Thank you. Are there others who want to make a comment or any kind of reflections?
Hi, good evening, everyone. I remember Paul when he first arrived in Rhode Island several years ago, and I know him in a different way from being a communication access provider. But I also had the opportunity to get to know him and to appreciate his humor, like everyone has said, and his generosity. For HSTP, for our virtual training series for the medical community, we did reach out to Paul to see if he would be willing to do a training about working with deafblind individuals, and this training is for the medical community. He did provide that, and we still have that training. I reached out to Margie to see if we could have permission to still use it for HSTP, and she did grant us that permission. So we do look forward to sharing that video with the community in the upcoming weeks. And we thank Paul for his generosity. And he will be sorely missed.
Thank you, Christine. Others want to, again, go ahead and comment on reflections about Paul? Bumi, did you want me to go ahead and read out what you just wrote in the chat, or did you want to speak it yourself? So I'm going to go ahead and read what Bumi has shared. Oh, I see you're here. Yes. So Bumi just shared in the chat, quoting her. She says, "Paul was my boss, and I still can't believe that he is gone. I cannot make any comment without getting emotional. I just want to say that he was a very great boss, and his sense of humor was out of this world. We miss him at Corliss every day." And that again was quoted from Bumi. So I want to just say thank you, Bumi, for sharing that in the chat. Others want to add any commentaries? I want to thank everyone for sharing what they did share. In the essence of time, I'll proceed with the meeting. But before I do so, I just wanted to take a moment of silence, a moment of quietness to reflect on Paul, and then we'll go ahead and proceed with the meeting. A moment of silence, please. Thank you, everyone. So next, I wanted to ask if anyone from the public audience has any comments before we proceed with our reporting, our business, etc. Anyone from the audience wish to make any comments? Yes, Amy. Hello, good evening. So I'm wondering, was the right time to ask this, but I just wanted to make a clarification from the ED, the executive director, their comments. Should I wait to ask my question, or it's for the executive director? So right now we're not making any comments. So I just wanted to ask a clarification about the director's part. I feel like it's very redundant. I know that there's a bill to advocate for the ADA, thank you, the ADA. So I know the law already states there. So I just want to clarify why we feel we need to be passing that here. I know that it's already there in the ADA, so that's my first question. And then second is related to the legislature, the HTP. So HSTP. So recently, I know that it was made in, I'm wondering, how do we measure the success? So I know that there's some programs that are being in place, but now I know this is the first year that we're actually moving forward with actually it being active. So I'm wondering if you can clarify on those two things. So HSTP, what exactly do you mean? So there's two legislatures. HSTP to become a permanent program for RI Commission for the Deaf and Hard of Hearing, or recognizing them to become another legislature's mandate. So I'm just wondering, I'm a little bit confused about that. To have them be other pieces of legislation, I'm not sure. Ernest, can you clarify? So that's actually a part of my report, so thank you for bringing that up. So Ernest will comment on that during his report. This is Tim speaking. So I know it's the last part that people in the community, their stakeholders, and so that particular legislation definitely it impacts the communities that we serve. So there are some things that we're going to be offering or proposing for this legislation. They do have an impact on the stakeholders, i.e. the community. So Ernest will include that information in his report. So the meeting minutes from May 19th, 2021, I believe has already been sent out to the commissioners. I want to quickly show those and then have anyone have a motion for revisions, and then we'll go forward if there's a motion with accepting them. So Bethany, if you can go ahead and screen share the meeting minutes from May 19th, 2021.
I just need to spotlight Tim, so give me just 1 second and then I'll scroll on down, okay?
Okay, is there any way that you can make this bigger, zoom in a little bit so we can actually see the print?
Actually, if, I'm gonna spotlight you, Letitia, as well. So actually, if you go to the top of your screen at the view options, you can increase the size. You have the option to fit it to the window, 50%, up to 300%. But this is what makes the less amount of visual noise and allows you to customize how big you want it to be. Does that work for you, Tim?
So I was changing it to 100%, so now I'm able to see it. So all of the commissioners, are you able to see this document on your screen?
Yes, I can see it.
Sorry, apologize there.
Caroline, I have it.
And if you just want to let me know, Tim, when to scroll down.
So I'm ready to scroll down onto the next page, Bethany. So for some reason on my screen, the document seems off-centered. So I'm just trying to recalibrate things here. So never mind. All back to normal. So this is Tim speaking. Are we all ready to go on to the next page? If so,
Would you like me to stop screen sharing?
yes, let's go ahead and stop screen sharing, please. Excuse me. So does anyone have a motion for revisions, or does anyone want to make a motion to accept as they are? Caroline?
I move to accept the May 19th meeting minutes as they are.
And this is Tina speaking. Oh, Tim saying Tina, and Tina is saying I second. Who are all in support or who are in favor, please place on your screen with a thumbs up. Kimberly? And Kimberly saying, I have a question, if I can be able to ask now. So if I wasn't there, can I vote? So correct. So if you were not in attendance at that meeting, you were not able to vote. I want to say thank you to everyone. The motion has passed, and we'll accept the meeting minutes as is. Let's go ahead and switch interpreters.
The rough draft of it, now that it's been approved, we'll post the final draft just to make sure that it has to be posted. I think it's a 35-day time limit. So we usually do the rough draft, and then once we approve it, we have the final draft. So thank you, everybody, for your review of it and your vote. So the next item in the agenda, we have reports. And the first report is from the chair. I'll make it very short. Basically, the meeting that we had on May 19th, in this period of time since May, I've been focusing on the Rhode Island College program at RIC, this new interpreter training program that is being called Public Health and Equity Sign Language Interpreter Program. And this is its first year, its launch year. And I'm involved in making sure that we recruit a diverse group, deaf people as faculty, people who are from the BIPOC communities, and to make sure that I'm involved in helping screen applicants and to make sure that some of the people, we could read the resumes and evaluate them, and then we come together and make a decision on hiring. So basically vetting. I've been involved with that. And the other thing, the executive committee, we met last week on Wednesday, and we had a meeting to prepare for tonight's meeting. And we had several things we wanted to bring forward to relate to our strategic goals that we've developed, and we will discuss them as part of tonight's meeting. The Education Committee I've been involved also in the meeting there last week on Thursday. Somebody had filed a complaint and we're still waiting for more information. For us to work on that, we'll contact people and follow up. There are some other things related to being a chair, but other than that, if there's no other questions, I'm going to pass this on to the executive director who's going to make his report. Hi, everyone. Good night. So for the executive director's report, the first is about the budget for fiscal year 22 that started on July 1st. And I'm very excited to tell everybody that we had an increase in our budget for this coming year. It's $64,603, which brings our total to $818,664 for the year to come. And that's a substantial, 64,000 is a substantial increase. Unfortunately, we did not get the 5th FTE that we were asking for, the full-time employee position. The legislature turned that down. I asked more about it to find out what we could do to follow up. And they said that with the benefits, retirement, vacation time, it would be such a huge cost that the legislature decided instead to give us the $64,000. We have talked with the Department of Administration, DOA, to ask what would the process be for the 5th FTE. And we had the budget analysts talk to us, and what they're saying is there's an entire process. It's not an easy path, and it takes several steps to get to. And there's areas in the DOA that have to be approved all the way up until it gets to the legislature. I cannot submit it directly to legislature. If I did it, that would be turned down. So we have to go with this process to the DOA and make sure it gets accepted then to the legislature. So with the 64,000, we can focus on contract workers, contract services. We already have contracts with Bethany Link. She has been working with us part-time, so we decided to increase her work to be full-time. And that's great. Congratulations, Bethany. And the other thing is for Lindsay Conway, she had been our program coordinator for EPCAP and RICDHH. She had been on contract since last June. And so we decided to continue it for an entire year. So Bethany will be full-time as of September, and Lindsay is continuing for this next coming year. It's an ongoing position for an additional year. So that's excellent. Thank you. And congratulations, Lindsay. And in addition, we're going to be adding $33,000 for the EPCAP program. And that will focus on purchasing equipment for, let's say, new laptops or new technology, whatever is needed for EPCAP to be able to work on communication access. So that will equal the $64,000. And we're so thrilled to have the increase to be able to spend it in this way. So updates around COVID. Mike Baer is here, which is great. And I'd like to have Mike make a comment about COVID because he's been so involved. The first issue is there was very low turnout at the vaccine clinic that Mike worked on with the Department of Health for deaf and hard of hearing people in the state to take advantage of vaccines. We provided interpreters, we had VRI, and we did it more than once, and it was always low turnout. I mean, not even 40 or 50 people, 20 people. And we discussed it amongst ourselves. I mean, Department of Health wanted higher numbers, obviously. And we were thinking, how can we revisit this? How can we bring the deaf, blind, late deafened people to come to these clinics when we make it available to them? And we were thinking about outreach. We talked about outreach. I see Mike is, yes, Mike, thank you. I will bring you in. I appreciate you saying that you're available. So we've been brainstorming ideas with the Department of Health, and we were thinking about using television ads to do more outreach about the vaccines, to get people encouraged to do the vaccine. Because what we've realized is we do it by email or on a website or on Facebook, and the ads do not seem to bring in, you know, we have deaf people that we've, deaf people who, we asked them where they saw it, and they said, oh, I saw it on Instagram, or I saw it on Facebook. We have people who have deaf parents who gave us different remarks, but it's not a lot of outreach. And we thought if we did a TV spot, people who are watching TV would see the ad, and they would, I think that very often a lot of deaf and hard of hearing people get their information from TV rather than other places. And from the kind of exit interviews we did with people to find out where they heard it from, they did not access a lot of our outreach. So we were thinking about doing a survey for deaf, blind, late deafened, hard of hearing people to ask if they have had the vaccine, and if they have not, why? And the Department of Health is concerned about the small number of people who are within those communities who've already been vaccinated, and they want that number to grow. So I was thinking that if we could have a video made, like I could say, I'm fully vaccinated and I'm deaf, and that it's all right to get vaccinated, and that it's safe and it's effective. And we could contact some people in the community who would be interested in being models for this, to be able to be filmed saying, I'm fine after having my vaccine. These were my reasons why I got the vaccine. So we'd like to have a few people who are deaf, hard of hearing, deaf blind, to talk about their experiences. And I'm working on that now. And Mike Bear, if you would like to add more to explain a little bit more about EPCAP and what you were doing about trying to bring more deaf people in for the vaccines, that would be great. Thank you. Do you want to speak? I saw you. Yes. Oh, you're saying you covered them all. Okay. Mike, he's saying I covered them all. Thank you, Mike. Okay, so the next item on the agenda is events that are upcoming. In the near future, there's a lot happening, and it's exciting. In September, we have Deaf Awareness Month, Hearing Loss Awareness Month, plus the Emergency Preparedness Month. They both happen in September. Emergency Preparedness Awareness Month. So we're thinking of blending those in a way so that Mike Bear and Pam are going to be working together to get the word out about deaf people, to understand more about emergency preparedness and how it overlaps with deaf awareness. So we'll have workshops, panels, with working on that now. And we'll think about that theme, bringing in emergency preparedness into all the different things that we do for Deaf Awareness Month. And then we have the coffee hour coming up in November. And what we're going to be doing, we're going to have a live component to it, an in-person on-site component for the coffee hour. And we were planning on a hybrid model where there'd be people speaking, there'd be awards given in person, and also there'd be Zoom. So people at home could observe and participate. But on the final day, we would have people come into the State House and be able to have vendor tables set up, exhibits, so that people, we wanted it to be the State House, and we've been contacting them, but we don't know if it's actually going to pan out, because we don't know if they're going to be open to the public by then. and we can host there or not. So we're coming up with contingency plans to think about if the State House is not allowing us in, what could we do elsewhere in another venue where people could come. Very often, it's an overdue social event. People enjoy it, but last year we could not have it. So we've had no social events for deaf people in a year and a half. And I know people are looking forward to that. And we will do more outreach. Once we have a location site set, we will reach out to everybody. So you'll definitely hear from us about that. And if there's any questions, please contact Pam Zellner and Mike Bear, both for the September Deaf Awareness and Emergency Preparedness and also for the coffee hour. One moment, I just wanted to say in November for the coffee hour, that will also be an event, an additional event, because we're going to be kicking off our 30-year anniversary to recognize the formation of the Rhode Island Commission for the Deaf and Hard of Hearing. So when we have the coffee hour, we're also going to have this launch of a year-long celebration that starts in November, goes till October of 2022. So we're looking forward to that. We're very excited about it. I saw Betsy Beach. Did you have a question? If you could reopen your video, thank you.
Yeah, I'm just wondering what the protocol is now in the state buildings. Do you have to wear masks in the halls? Do you have to have certain numbers of people? How is the reopening going? Is it gradual or is it just all of a sudden it's open? Because I know we will be in person the next time we meet and people have been in at work. So, yeah.
And actually, at this point, I don't know what the plan is up there. We have been in contact with them, trying to find out what's available and how they're going to be moving forward on the reopening and whether it'll be open to the public. We want to make sure that we have the correct information, and then we will update you either at the next meeting or through an email, because we are waiting to find out more. They have not opened to the public yet, but they do have people, who are working in the building, and those people are there. So I'm hoping we will have more to update you about. Okay, and I did want to talk about this, the coffee, sorry. I'm seeing somebody. Okay, I thought somebody was trying to speak. The coffee hour in November and the kickoff of the 30-year anniversary, that's going to be an exciting time. And what I wanted to say is that it's going to be 11 months of activities till October of 2022 when we do the big event. So we'll have more to speak about for the 30th anniversary. And it's very exciting. It's a big thing for us to have hit 30 years. So I'm excited about that. And I wondered if there were any questions. You can certainly contact Pam and get more information about what's being planned for the kickoff for the 30th. And the actual event will be in November 2022, not this year, but November 2022.
So now as it pertains to outreach. So we've been making some thoughts around emailing for volunteers, one for a committee chairperson, a vice chairperson. Tim and Caroline both have received those emails. And the committee for for the education position as well, and then for healthcare as well as ad hoc, and to have those positions available. So those emails have been sent out for the purpose of the community members, if they have any concerns, if they have any thoughts or feedback, or any direct questions related to those particular committees, or related to employment or education or healthcare, et cetera, or ad hoc interpreters, CART, referral services, et cetera, they can actually email those respective individuals. And they can basically come back and be the liaison to come back and share that with us. We want to have some transparency. I think that's key in terms of building trust, having communication. And we basically take that information and then we'd have a discussion amongst ourselves. And so I set up those emails to those particular chair individuals, the vice chair individual, so everyone in those particular individuals for the committees as well. I also have been giving some thoughts in terms of how we can set up forums for outreaching to the Black and Brown communities, particularly Black, Indigenous people of color. We're trying to think of how to reach out to those respective communities, to have dialogues with them, to recruit them. We're trying to do that, but unfortunately, I've been seeing no interest. And I know that today there has been, it's a touchy subject, but I do want to hear their needs. I want to hear their concerns. I want to hear their feedback, and where we as Rhode Island Commission for the Deaf and Hard of Hearing can better serve the Black and Brown and Indigenous communities. And I would be interested in seeing them actually join the commission and lend their support, and have, again, more transparency, more collaboration with those communities so that we do have a colorful and diverse perspectives. So I'm just trying to think about more strategic ways of recruiting individuals from those communities so that we can hear their feedback and hear their concerns, but it's been very hard to do so. Rhode Island in terms of publicizing, we've been thinking about one particular committee, and where we've decided that our staff, we would go ahead and video and have that with voiceover. We'll have our staff bios there with their background, their picture, and all of us, all of the staff, they would go ahead and be included in this project. And those particular videos would be up their bios, and we would send those out pretty soon. And people have the opportunity to read their bios, but also see it in American Sign Language in terms of what are our roles, what do we do? And you'd be able to see that on our website. And so that information will be ready and available for individuals to go ahead and see on our website who the individuals are and what we do. In terms of legislation, I know one individual had made a comment about getting clarity on a particular legislation. In terms of the Rhode Island staff, and we've been thinking about the legislation to propose certain bills. So right now we have the draft in motion, and the stakeholders can reach out to us and set up a meeting to discuss those particular bills. We have the first step up bill, which we're starting again in terms of garnishing the community support. The first bill, after I met with the Rhode Island Commission staff, there seems to be some attention on the 17-year-old that was using law enforcement. They were using them as an American Sign Language interpreter during an interrogation. And plus, we were seeing this again and again and again. And so I know that the ADA policy and ADA law states that there needs to be more education in terms of the legislators that these are some severe and grave issues that you can't use underage interpreters during a crisis situation or during law enforcement involvement. And so there needs to be some kind of ban, if you will. But again, law enforcement is not heeding. And so there needs to be some kind of severe consequences if that does happen, because it has been happening time and time again. And so I just wanted to put out there that those bills are not currently in process. They're just drafts, they're just ideas. And we do need to start somewhere with having these drafts to really address these severe issues. So if there's any kind of amendments, we can always talk to legislators in terms of saying basically it's unethical practices and that needs to stop. And so we're just, again, dipping our feet into the water. And I see a comment from Amy. Yes, Amy, did you want to add? Yes. So I just wanted to add, because I work with several deaf and hard of hearing and blind individuals in the area. Can everyone see me? So I just wanted to add, because you were saying that it was happening again and again. I work with the deaf and hard of hearing and blind individuals with law enforcement involved very often, and my agency provides VRI services, and children shouldn't be involved in that. And the police know that, and they've been using it. However, I know that there was one family that I know that tried to use their daughter to help their parents. And I had to educate the parents to stop doing that. Yes, it's an ADA violation automatically. And with DOJ, their job at the Department of Justice is to basically sue the police department if that keeps on happening. And so I just am thinking about saying that if it continues to happen again and again, it's not really accurate information at all. I think that we just need to clarify that we have seen a lot of it happening. And we say, no, we intervene before they actually try to use the underage interpreters. So it's not appropriate communication, right? So I think that maybe that can help with your decision on that particular bill. And Amy, thank you so much for sharing that. And this is Tim jumping in. Amy, I want to say thank you so much. This is Ernest speaking. In terms of the bills and these particular issues, yes, we would love to discuss this more. Again, this is just a starting point. So I want to say thank you, Amy, for clarifying that and bringing that topic up. Tim, you wanted to add? So I recently was speaking with one staff at Rhode Island. Can you see me? Perfect. So I was recently speaking with one Rhode Island senator, excuse the interpreter, in that area. I was invited to a barbecue and I was just having a conversation with them. And I remember before we used to have a language assessment bill, but somehow it didn't go through, it didn't pass. And with the education committee, they now changed it to having a new chair. And that chair is also from my area. And if they actually want to go ahead and introduce that bill again, I think that it could actually pass through because of the education committee's chair, their connections. So that's just a suggestion that I think that we could actually work with. I can discuss that a little bit more later, but I just wanted to drop that idea. And this is Ernest speaking. Thank you so much. So related to the Healthcare System Transformation Project, HSTP, it's been about 1.5 years, and where we have made, I'd have to say, much progress. We have made we've been doing a lot of networking and a lot of connections within the community. And we actually are seeing a big difference in Rhode Island in terms of setting up the Public Health Equity Interpreters Program, which will start officially in August. So in terms of setting that program up, just setting the surveys. We're building, again, networks and community collaborations. We're really seeing the difference. I really want to hats off to Alex, Christine West, and the team that has been spearheading that program. I know that the money that we've gotten from the HSTP program, it was a grant. It is limited and funded. I believe it's up to 5 years, but that money will definitely deplete very easily. I'm a bit nervous around that. But the HSTP group, they've been working tremendously hard. And I'm sad to say if that money runs out, then the program will then fold as well. But I don't want to see that happen. I want to see the HSTP project continue. I want to have a strategic plan in place where we can actually maintain that project and keep that going. And having other individuals be involved in terms of perhaps garnishing more funds from other corporations or companies. Because healthcare in particular is a serious issue here in Rhode Island. I can't say that enough. Something needs to shift, something needs to change. And I believe that that HSTP program will actually make the transformation as requisite. I know there's many people that are out there who, are thinking about it in terms of giving us money, but we actually need to really find the funding so we can keep it going. So we're just trying to strategically think of how we can keep the HSTP. Do we want to add the HSTP to our Rhode Island department? Perhaps the interpreter referral or CART services. The educational program, maybe it could be the fifth, could be the HSTP program. We definitely want to maybe perhaps add that as an additional department to Rhode Island Commission. Or even we can reach out to legislators and ask that the HSTP be mandatory. I know that maybe we can add that to become the 10th, because right now it's the 9th, and could it be a mandate? Could it be mandated, if you will, that where they would recognize the HSTP? And if it's mandated, then we would get the funding. So we as a team would be ready to support that. We would be able to have that in regarding it being mandated. So we as a team, as a staff, could support that. Again, is that something that's definite? Is that something that we're putting set in stone? No, we're trying to just tap into individuals and see where they stand with this particular vision. Because again, the HSTP isn't here just for a temporary basis, but I want it to be long-term because I can see it having a tremendous, like I said before, impact on the community and our members. And so we actually, again, we need the change, and the HSTP whole point of it is to provide training and to improve the understanding about how to work with deaf, hard of hearing, and deafblind individuals. So we need something, and that something is the HSTP. And so we just have to think about how we can keep that for a long-term goal, not just something that is short-term.
I'm seeing one person writing. Bonnie Kaplan has a question. If you wouldn't mind opening up your video so that you can ask the question you wrote in the chat. Bonnie Kaplan. Bonnie's saying hello. What I meant was, do you have evidence to support your comments about HSTP, that the need is there big time? Do you have numbers? Because I read somewhere that the survey that went out actually had very low response and that it wasn't quantitative enough. So I'm thinking we're jumping a little bit ahead. And do you have the numbers to support? Because I always want to see evidence and support. I don't want, to be people just, talking out of their butt, basically, with making statements without the evidence to support it. Thank you, Bonnie. I see. Okay. Thank you, Bonnie, for your comment. I understand your point and your point of view. And of course, I've been working with the healthcare team. I feel there is evidence, there is statistics, there is data. And we would put those collections of information before we'd go back to any legislative bill. So your concern would be answered. Christine West is here. She could certainly explain what HSTP has been doing so far and give a little bit more detail. I can certainly let her explain that. I just feel that I can envision it happening in the long term rather than it running out of time and ending its service. I'm going to move on. I want to talk about the office statistics for the month of, for the month of June. So RICDHH information and referral. We have that report. How many requests we had for information and referral in June? 36 for the month. Asking for information and referral. And Pam Zellner has sent out, the information requested. So 36 times. And then interpreter referral, interpreter and CART requests. We received in the month of June, 258 requests for the month of June. There were jobs, 35 that were canceled. And there are different reasons why they were canceled. It's unfortunate, but most of the assignments, 112 of them were medical. Mental health, there were 44. Medical and mental health are the most requested for the month of June. Anything else is much smaller, like a Quaker meeting, different events, legal. There were some duplicates for referral errors, 7 of those. The next item, the governor requests. There were 77 under the state. 19 were canceled. Mostly the state was focused on meetings. There were 28, education, 29. And other, like medical, there was 1, employment, interviews, 1. Other kinds of events, 12, and then legal court, 6. For CART reporting, we had 10 requests. So that's my report. And if anyone has any questions, I'm happy to entertain them. Tim is saying hello. I see Christine has opened her video, and maybe you want to clarify, Christine, about the data, the question about HSTP. Please take the floor.
Great. Thank you, Tim. I just wanted to respond to both Amy and Bonnie's comments about the data and about HSTP. Yeah, in terms of the survey that we conducted in partnership with Gallaudet University, we didn't have as much of a qualitative section to that. However, we are hoping in the fall to be able to capture some more qualitative data due to the fact that Gallaudet had certain protocol to follow as a part of developing the survey. We were unable to include that, but we are hoping to do that in the fall because we're able to meet in person with folks, and we were not able to do that up until this time. So we certainly hope to collect some more of that qualitative data, include it in our final report. I do also want to mention that this is the first time that the state had conducted a health survey of the deaf community that was fully accessible in both ASL and English. And I think that was something to be noted. When you compare other surveys that were conducted, the communication services for the deaf CSD had hired some folks or contracted with some folks to conduct a survey. And that included 10 different states, including some of the largest states in the country, California, Texas, I believe Florida, Massachusetts. And in their survey, they were able to capture around 350 or so responses. In Rhode Island, for our survey, we were able to capture 135 responses for our small state, which I think is pretty good. Not all of those responses were included in the sample because there were some folks that did not answer all the questions, or there wasn't a 90% response rate according to certain variables. So all in all, I'm pretty satisfied with the survey that we administered with Gallaudet, and the fact that our response rate was pretty good for such a small state, and the fact that it was done during COVID, I thought was a pretty good accomplishment. And I want to celebrate that. And I want to celebrate all the hard work on behalf of our team who had worked on that, and also to celebrate Gallaudet, who also worked very hard on their end for that. So I just wanted to add that. I do welcome any feedback from anyone who may have it. If you need my email address, or if you have any feedback on ways in which we can improve the healthcare system transformation project, please reach out. We've been available since the beginning, since we started about 1.5 years ago. So if you have any feedback or ideas on how we can improve, I look forward to that. So I just wanted to add, thanks.
Yes, Tim. Thank you. So it doesn't seem there are questions right now for the executive director. I wanted to move on to the committee reports. But it is 7:10. So I think we might want to go on break and then come back and move on to the committee reports. I think that would be a good use of our time. So let's take a break of maybe 5 minutes. Is that enough time for people? People can grab a glass of water, go to the bathroom, whatever they need to do. We'll reconvene at 7:15. All right, thank you.
So Betsy Beach, are you ready to go ahead? Are you ready for your secretarial role and taking notes? So Drew, do you mind clarifying your question, please? So I recently got an email that the executive, the Open Meeting Act. So all meetings going forward will be in person. So I just was wondering if we can actually talk about that. Just because I think there may be some concerns from the community. So it's not on the agenda, but it was mentioned on the executive report. So I'm wondering if we can talk about that, the executive order. This is Tim speaking. So we had already planned to discuss about the executive director, the evaluation that's going to be for next week, but we can go ahead and discuss that. If we're going to do that in person, or, I mean, it's still related, but how do we handle that going forward for these particular meetings? I'm hoping to use that as an opportunity to discuss that. Yeah, I know our committee is next week, and so I just wasn't sure what we should do. So, and Tim's saying, yes, we can discuss that. So I'm hoping that different committees, these reports will be brief. If there's anything quite essential, you can go ahead and go into details about that. But we'd appreciate if we can keep them brief. So first is the Educational Committee. I think we had already covered that one. I'm just in brief summation. I know that we had planned on setting up a forum, a community forum for others to gather, basically open to different issues to be brought to the table. And that was going to be in the month of October for the purpose of us setting up improving services, community education, social services, that sort of thing. And so that's the purpose of our meeting coming up, is to plan that, but that's a brief summary of that community forum. The employment committee, I know that we have a list of items here. People can read them on their own, but do you mind briefly sharing out on that?
I go to the employment committee meetings. We had a really successful webinar. In fact, Brett Hayes was one of the people interviewing people's experience, people who are deaf and hard of hearing, and their experiences at work. And if you haven't had a chance to see that, it's on the commission website. And the representative from the Department of Labor, who's on our committee, was very impressed with that. And she wants to make the Department of Labor events, especially their job fair events, all accessible, after getting a chance to listen to people's experiences. So she invited someone to our last meeting, and they're going to come up with a plan to have job searches and job fairs that are done through the Department of Labor, have them have some interpretation and more accessibility for deaf and hard of hearing people. I don't know, it was just very exciting to do an event and immediately see a good response for it.
Great, thank you, Betsy, for your report. The next is healthcare. As it pertains to the HSTP program. Brett Hayes, did you want to go ahead and share on that? I know that we already have the document here that lists out information, but if you don't mind just giving a quick summary.
Yeah, unfortunately, I don't really have any update for the healthcare committee. I actually owe the committee a response to try to set up a meeting for August. So that would be the next step for the healthcare committee, and definitely wanted to check in and see how if there's any support that the HSTP team would need for the interpreter training program. So that's kind of the next step, but in terms of update, we don't have anything at the moment. Thank you.
Great, thank you for your time, Brett. Technical access. We'll be meeting in September 7th, I believe is the very first meeting. So there would be no reports tonight. Ad hoc, interpreter referral, and CART services, that committee, there's no reports. They had a meeting back in May, and they had already reported on their updates in May. The next meeting is on July 27th. So these are all the committee reports. Are there any questions? Tina, you're on mute.
Sorry. So I am on the ad hoc committee. And yes, we meet on July 27th, but probably not, because we keep trying to ask what's up with the executive order ending and how that's going to affect us. And so we wanted to talk about that, but obviously maybe we can't talk about that. But this is, that's our report, is the executive order ending about Open Meetings Act impacts a real way. And so we gave up our meeting in June to save money. And now we probably cannot meet in July So that's our report.
Thank you. Ernest, do you mind going into details around the executive order from the governor, Mike? In terms of, do you mind go ahead and explaining a little bit more about that? Because in terms of not being able to meet via Zoom. Just if we can go ahead and clarify about that. So I did get the information from Governor Mike this morning in terms of the executive order that all virtual meetings will no longer happen. And the end of that would be this Friday at 4. So at 3, you can have a virtual meeting, but after 4, that has to end. Everything starts back being in person, effective Friday at 4. And that will continue thereafter being in person. So I reached out to our legal counsel team and the office of Office of Attorney General. I reached out to them as well, with sharing our concerns, and they said that we have to follow that order from the governor, that no longer meeting on Zoom or any kind of virtual platform, all must be in person. All meetings thereafter must be in person. Legal counsel had said, or the Rhode Island legislatures, they couldn't make any kind of decisions. Basically, everything is closed in terms of using virtual opportunities. Everything is quote unquote back to normal. So many people are, of course, not upset. I mean, many people are upset about that. It's not just us. Many people are in frustration because this is very unexpected. It's very last minute. And we have to follow the Open Meeting Act. And that's in accordance with the governor's directive. So therefore, our concerns and grievances, we have to send them to the governor's office. We have to keep
The executive order.
We have to keep with the executive order to basically follow through that every meeting will be in person. But we can share our concerns. Right now, our hands are tied. We're backed up against a wall. We're trying to get more information again to send that over to legal counsel to then bring it up the chain. In terms of Attorney General, trying to get their counsel on this as well, but we're not the only ones that are in grievance with this. Many others are. So again, all meetings effective Friday at 4 p.m. must be in person. Amy, you had a comment or a question rather. Do you mind coming on screen?
Numbers can switch now. So Amy's saying, Ernest, I just wanted to say that there are some people on the board and those who have family members who themselves are immunocompromised. I don't know how to sign that really, but immunocompromised. And so the issue would be, like, I have a child who's too young to get vaccinated, and we're worried about getting COVID. So there are some people who have other reasons. It could be commissioners. So I'm wondering if the ADA, protecting people with disabilities, people who have physical issues, could possibly supersede this. You know, I didn't explain it very well, but that's what I mean. And Ernest is saying the interpretation for people with disabilities is if somebody cannot show up in person, but if a person can be there physically, that means they are fine. Let's say you broke a leg or you had some other disability that you could not come into a meeting in person. You could join by the electronic means. But all of us are basically able-bodied and we can come to a meeting. So that is difficult. And we need to follow what the Attorney General and our legal counsel have dictated. I think the trouble is Governor McKee has said this and they're feeling like, well, we have to follow this. I understand your concern. I hear your concern, but this is the first time we've had this experience. And I'm hoping that there'll be more discussion to see if there's any waivers or exemptions, but otherwise it's hard to answer that question. Well, disability is a very, very broad definition. It shouldn't just be physical disability. There's other kinds of disabilities that are related and also not visible that could be related to COVID or related to meeting in person. And I think it's extremely frustrating for us. We were upset about that. Back in June, we had to hold off a lot of our work. And now here it is July. And I feel like most of us cannot attend because the meeting is so last minute. The change in the meeting, having to go in person rather than online, and it's next week. So that's a difficulty. And Tim is saying, I'm happy to support this effort in whatever way needs to happen. If there's follow-up or if you need to, if you're going to be speaking to the attorneys or whatever. Yes, Betsy, I see you.
Yeah, that's sort of my question about the buildings being open. I had to pick up some equipment from Denise Corzone at ORS, and they don't have their lobby open to people. I mean, there's still restricted areas in the buildings. So, I mean, are the meeting rooms able to be used at the Department of Administration for our meetings, et cetera? Because I still see places in the state buildings that are not accessible at the moment.
Yes, this all happened so quickly. We just heard about it today and it's taking effect on Friday. So we will be pursuing it. I'm sure Ernest will be doing more homework on where we're going to meet and how we're going to meet so that it can, from moving forward from here. Yes. Okay, so I'm going to move on to the next item, which is unfinished business. Well, I don't want to cut off anything. This isn't really on our agenda, but I know it's a hot topic right now with the Executive Order 2772, and people are worried about it. And I think there wasn't enough we can clarify right now. We don't have a lot of answers. So I did accept some comments about that, obviously, and I wanted to know, can we move forward at this point then? Yes, I see Drew. Drew is saying, I did want to add, there are some comments that people were saying maybe we could use as support for Governor McKee, like the interpreters Tina was mentioning. Many interpreters have booked Zoom assignments through the rest of the year, and we have confirmed those. Now, can those people still appear in person? Are we going to lose the services of those interpreters? That could affect communication access. And some of us, I mean, it may not affect everybody, but let's say with me, my job, if we're having a meeting and it's 5:45, I can't really meet unless this is resolved. I just wanted to tell people that, and I think there should be, maybe it's going to limit the access to meetings. And so we have things that we need to pass and we need to vote on. It's going to impact that, the number for the quorum and all of that. So these would be things to add content for you to use as an argument. Anything else? I will entertain more before I move on. Did you have another comment? Yes, Ernest. Ernest says, I did want to answer Drew's question about interpreting. For interpreters, when we got the order and we talked to the Attorney General, some interpreters could still work remote. Like we have BRI under our MPA, our master price agreement, and that allows remote. But people who are on the commission needs to be there in person. The interpreters could be remote. And so I will forward you what I have gained already from our counsel, both the Attorney General and our legal counsel just today. And after this meeting, I will send that to you so that you can see what their interpretation is about the commissioners and about interpreting services. Thank you. And Caroline, I recognize you.
Okay, so as we all know, I'm the most technically challenged member of the commission. However, I have a very hard time understanding or conceptualizing how the commissioners could be in person and our interpreters would be remote. Would we have cameras on us? That would thus make it a sort of Zoom meeting. So it just doesn't make sense to me.
That is a good point. It is complicated. Oh, wow. Ernest is saying, you're right. Like everybody will be sitting around the table and we'll all watch the interpreter on a big screen. We're going to be projecting and the interpreter will be interpreting. It is a little odd. Why are we there in person? That's true. That is true. That's going to be a tough sell on access. And Tim is saying this just happened today. So Ernest is doing his best to answer as much as possible without very much information. We're going to hear more Thursday and Friday. We'll be following up. And some of the ideas and suggestions you've expressed your concerns, those will be brought in. It's a lot. We all have a lot of questions and we don't have enough answers. So yes, thank you. Thanks for participating. So we're going to move on to unfinished business. First of all, it speaks about reviewing and approving the strategic goals. You had approved the general 4 that we talked about after the retreat. And now, last week at the executive meeting, we developed those 4 into statements that are more specific or detailed expectations of what we would finish as far as measurable tasks that meet each of these 4 goals. So can we share the screen for the paperwork that we developed with the 4 statements? Ernest, hi. I just wanted to make sure that we can get that up. Bethany, do you have the statements from last week?
I do. I'm pulling it up. Give me 1 second.
Ah, good. I didn't know if you were there or if you had it. Perfect. Great. This is the vision and mission about RICDHH and the guiding principles. Then we talk about the strategic plan starting fiscal year 2022. If you could scroll up a little bit, Bethany. There we are. So these are the 4 points. And under each of these points, we have some goals and objectives that we want to complete in the coming year. So for the first one, it has to do with increasing diversity and inclusion on the commission. So we talked about creating an action plan specifically for this purpose so that we could involve, let's say, community members, get some ideas from them to identify action steps so that we have clear expectations and we can make plans going forward into the future for a year and out. The second goal says, improve the interpreter referral service. That was one of the things we talked about at the retreat and we approved as one of our goals. We are already in process of doing that. We actually identified as an action item We have internal recommendations from reviews from the executive director and the staff within the office. And now we have the ad hoc referral, interpretive referral and CART. They are going to do reports suggesting improvements. So from internal and external sources, this next year, we'll have some improvements being offered there. The third one is developing a public communication strategy to increase awareness about the commission, outreach to diverse, deaf, deafblind, hard of hearing, and late deafened people in the community. So it's one of the issues that we talked about with more visibility, more transparency. And I'm trying to think of what the third word was: visibility, transparency. There was a third item that was on the original strategic plan. Oh, communication, outreach and communication. Yes. So the fourth strategic item, we were talking about increasing relationships with the legislature. When we put a bill forward to them that would network in general, the General Assembly, excuse me, to help educate them about the rights, needs, and priorities of the diverse deaf, deafblind, hard of hearing, and late deafened community. And what that basically means is we would get information about what the needs are, what are the priorities within the community first. And then we would use that information to help when we network with the legislators so that we can educate them as to our needs. Thank you for sharing that. You could turn that off now, Bethany. Appreciate it. Okay, thank you. So are there any questions or points about that? And now that you've read those four, do you feel that those, I mean, we already had discussed them and we approved them in general, and now we're looking at specific, what can we achieve in the coming year? And these are measurable tasks. If people would like to add or revise any, if not, I would like to hear a motion to approve these as written. If there's any questions, I'll address those now as well. Betsy Beach. And you're muted, sorry, Betsy.
Are these written up on the website? Is that where were you reading those from?
The beginning part, the vision and mission and guiding principles, is obviously on the website. This next part about these 4 strategic goals, those were just developed last week in an executive committee with Caroline Obrecht, myself, Brett Hayes. The 3 of us were there and we gave input to them and typed them up. So we're bringing it now to the full commission to decide if we need any revision or can they stay as is, and to begin our work on those tasks. So we're bringing this to you folks for the first time to see if it's satisfactory and approved. So it is not on the website. It has not been posted because it hasn't been voted on yet. It was just a rough draft created last week at the executive committee. Any other questions or comments? And if not, is somebody ready to make a motion to accept them? So moved, Tina. Okay.
I'll
Thank
make a motion to accept them as written.
Thank you. Do I hear a second to Tina's motion? Drew, thank you. Drew seconds. Drew Balsley. So if everybody can open their video to show whether they support it with thumbs up or they oppose it with thumbs down, or if you're abstaining or not voting, you could do some sort of gesture to show that you're not voting. Let me count who's here. Sorry, let me go back. Thumbs up, Let me count. And Bunmi, you had a thumbs up? All right, thank you, thank you. So I'm seeing 8. So that's unanimous, no opposition, no abstaining. Those 4 strategic tasks will be, the goals will be established for what we're going to be working on in this fiscal year 22 for the year coming forward, moving forward. Okay, next item. So this item, which is 9B, under unfinished business, it says discuss the roles of the commissioners. And, you know, we had the reports. That's a new idea that we had, to have them sent prior to the meeting to the chair so that we get some more prep for the meetings. It could be a week or more in advance, or if the committee after the meeting wants to send a report, they could even. And that would be included in our report. But I'm wondering if people have any thoughts. And if there could be a motion about, let's say a committee wants to bring a motion to the table, or somebody from the community wants to say something that they want to be brought up in a meeting. People can email me or they can email Ernest, and that will be documented. And then at the time prior to the meeting, we would review those items and put them on the agenda, prioritize the orders, you know, the order of those items. That would be better than me making the decision unilaterally with limited information. That way I can develop the agenda in concert with everybody. And I was thinking that if there's anything specific, part of the process that people would like to have improved, or something that they think could function better or more effectively going on, I'd like to hear that at this point. If anybody wants to comment, we're going to switch interpreters.
So if there are no comments, we can then move on to the next item. What I'll do is I'll go ahead and type up a general guideline, a list of the guidelines that will help us plan for future meetings. So once the chair is done, then we can then pass that on. And that's something that we can actually keep things with open communication and things going smoothly. So that hopefully those guidelines will be able to help. But if there are no comments, then we'll go ahead and move to the next discussion point, which is, I know last week we had some discussion around the feeling of wanting us, the Rhode Island Commission, to hire and to work with Shane Feldman through ANIV in terms of strategic planning. So we wanted to go ahead and hire them for FY 2022.
Interview.
So basically in terms of working with our strategic goals, and in terms of the executive director's evaluation, et cetera. So we wanted to really use them to help with our strategic goals. So if any of you feel as though, yes, you are in agreement with this, or if you want to have more discussion around this hiring, we can have discussion, or someone can make a motion. Anyone have any discussions? I want to recognize Betsy.
Just wondering if his duties were completed for the last year. I mean, I thought the retreat was excellent. Just wondering if there were any concerns after? I haven't heard much about anything that happened after the retreat. I assume that he sent everything on and he had evaluated what we had done. So is there some kind of wrap up for what he did last year for us?
I want to recognize Carolyn Obrecht.
I don't think of it so much as a need for wrap up as we have some new issues about to face us. I know that Tim would like to move out of the chair position, so that would be a big transition for us. We're looking to recruit other commissioners, so again, that would be transition. And continuing to support the work of HTSP. So I think I was hoping that Shane, as he knows us and worked well with us, could help us move forward with some of those goals.
Others? Discussion, comments, questions? Crickets? Silence? Any takers? Oh, yes, Betsy.
I think it would be a good idea. Because it's a different focus from people in the office just doing the day-to-day tasks that they have a job description for. This is kind of, I think Carolyn's right. Maybe it's not so much did everything fall into place that we did last year. It's more that there's even more needed. I tend to think it's a good idea, but I'd like to hear other people talk about it.
Others? I want to recognize Drew. That transition process, I think, would be helpful to have him. I know that retreat we had, there was a lot of kinks to work out and to kind of figure out how things would pan out. So we had to kind of clean up house in that sense. So it'd be nice to have him there to work on our goals. So I think it would make sense to go ahead and hire him. So I want to go ahead and make a motion to have us continue working with us to work on our strategic plan as well as our strategic goals. And this is Tim. We have a motion on the floor from Drew. Anyone second? Second the motion from Drew. So I say thank you, Drew. I want to recognize Betsy Beach.
I'll second the motion from Drew.
So we have a second on the floor from Betsy Beach. So now I want to open that up for discussion for if anyone wants to discuss either in favor or are against the motion that's on the floor. I want to open that up to the audience. I see that it's quiet again. No one has anything to share, any discussion points, or do we want to go ahead and close the discussion? Okay, so if we can have everyone come on screen in terms of who is in favor, who abstains, or who is against. With a thumbs up. So we have all, I believe, I'm just counting everyone. So we have all 8 members that are in support. So if we can go ahead and turn off your cameras. So we have 8 So this is a passing motion. So all 8 members have voted in favor. There were none that were in opposition, and so this motion passed. The next step is that we will have Ernest, myself, and Caroline Obrecht. We will start the process in terms of getting his scope of work. And then at our next meeting, we'll bring that to the committee to make sure everyone is on par. And we'll go ahead and approve that with Ernest's signature in order to work with him. This is the final step. This is not the final step. This is just the first. So next on the agenda is new business. I'm going to speed through that. So first, the executive director's evaluation that is going to be held next Wednesday, I believe, July 28th at 6 p.m. I'm not in the position right now to say anything on Zoom. So we will have everything on Zoom. We have to figure out, should we move forward with keeping that meeting? Because I know everything has been worked out, but again, in terms of the interpreters, they were committed to going on Zoom, and as well as the CART reporter as well. So kind of against the wall. Ernest, do you mind coming on screen and maybe sharing a little bit about, or clarifying rather, about what next Wednesday will look like and what's the plan? This is Ernest speaking. Bethany will check in with the interpreters, and if they're willing to show up in person, we definitely need to clarify with them. And I also wanted to clarify for the evaluation meeting with myself, it will be public as it was before. So that means if the meeting becomes public, meaning that it would be open to everyone, and that in terms of the interpreters, CART, if they were to show up in person, that would be the plan. So I just have to check with Bethany to reach out to the access providers and just to see if they'll be able to show up in person on Wednesday. And if that's a yes, then the meeting will be held in person. So we're just waiting on Bethany to get back to us. Again, I'm not sure if the interpreters are willing to do so. I know a few interpreters are willing to go on site because they are vaccinated, but then those individuals who may not be, again, Bethany, she would be able to answer that question in terms of if the interpreters, again, are willing to come on site, then that would make the meeting on site. So Bethany, did you want to come on and share a little bit?
I am still contacting the interpreters right now. I do know that one of the interpreters for next week's meeting would, if it was in person, would need a sub because they will be out of town.
Thank you, Bethany. This is Tim speaking. So I just wanted to know how many of you can actually be in person next Wednesday for the evaluation. I'm just trying to figure out, should we go forward with the meeting or should we actually reschedule it for another time? I know that August, there are many individuals who are busy during that month. And I know that we have several events during the second week of August, I believe. Trying to jog my memory. What is it, the 14th, 15th? Yeah, the 14th through the 19th, I think it is, that week. And Ernest is agreeing for the interpreters equity interpreting program, the healthcare program. I know that we have several events that are happening that week in the evening. And so there's going to be several conflicts. I also know some people are maybe heading on vacation in a couple of weeks of August. Interpreters may be on vacation. So I think that's where I want to open up this discussion in terms of, should we keep the meeting next week? Are people able to come July 28th in person, or do we want to reschedule? So I just want to open this up for comments. Is there anyone that can't show up next week if it's in person? Maybe that's where I should start. And who cannot come next Wednesday if it's in person? Brett?
If it's in person at the same time, I wouldn't be able to come in right away. Is it gonna be 6 p.m. or 4 p.m.?
It's at 6.
Okay. Right. Well, I can't promise I'll be on time, but I can probably make it late.
Okay, thank you, Brett. Others? Yes, I want to recognize Betsy.
I think I can come in person at 6.
Others? Others who can't? Anyone who cannot come next week? Drew, I know that you had some concerns you had shared earlier in this meeting. Yes, generally right now I'm not in person and just in terms of the population that I work, so that's not an option for me to be in person. Others? Who else can't make it?
Try to work it out. Right now I'm booked right up to then, but I can try.
I'm sorry, Tina, you broke up a little
And
bit.
I'm booked right now up until then, but with drive time, maybe.
Okay, so it seems right now we have one person that cannot show up. David Maloney, they recently, their partner gave birth to a baby, so I'm not sure if they're able to come to the meetings. So it seems like David as well as, Drew won't be able to make it. So we have 2 individuals who won't be at the meeting. 2 are indicating that they may be late for the meeting. So that's 4, well, 2.5 to 4-ish. And then left on this meeting, we are able to make it, but I'm thinking maybe I can delay it a little bit or maybe have a different start time, maybe to start around 6:30. I'm wondering if that would give individuals enough time, maybe 6:15 or 6:30. What would you all prefer if we were to start not at 6, but at 6:15 or 6:30 instead? Thoughts?
Yes, Betsy.
How late are we going next week?
The meeting is focused on evaluating Ernest. I'm hoping it's not going to be like 2.5 hours or something, but maybe an hour and a half. That's my guess, my best guess or my hope. If it went on over that, I guess that's kind of up to you, how whether it goes over. And Caroline?
I think the entry-level question really is, do we have the 2 interpreters and do we have the CART reporter? So I think that's where we need to get the information first.
Yes. So if that worked out, I would of course want to also make sure that you all can make it as well, because I want to save our time. So what I'm thinking is we have to hold off on this question only because Bethany will have to make a commitment, find out if people can make a commitment who are already going to be doing service provision. And then if people prefer 6:15 or 6:30, so that gives people enough time, if you're coming in person, then you have drive time and traffic and all of those other things that get in the way logistically. So maybe a little later is a better start time, and it might work out better with the interpreters and the CART providers. And we have to think of where. There are lots of different questions. Where would we meet? And we have to come up with that pretty soon. So we'll probably be working on this Thursday and Friday this week. That topic in the new business, I think we're good at this point, or as much as we know at this point. The other thing I wanted to talk about is in expiring terms. As of July next year, some of the commissioners will have finished their terms. And we can always have people, if they want to continue, they can renew their terms. It's up to the other commissioners to vote and approve that, an extension of term. But if somebody has served 2 full terms, so 2 years plus 2 years, that position must be open for an interview to allow other candidates to enter if they want into that position. So we could decide after an interview process that we are going to keep the same person who had it prior, or, you know, pick somebody new if that ended up happening. So one thing, Bethany, do you have a list that includes whose terms are expiring?
I do not.
Okay. So I'm trying to think out of us. Do folks know which, if they themselves, oh, Betsy, I see you. Yes.
Kim, I think you're on the same year as me, and it took a while for us to be approved, but I think our term just expired again. I know we only talked about staying on like maybe a year ago. I think we're up, both of us. And then I don't really know about anybody else.
So what I will do then would be to ask Ernest if he could review the terms and the expiration of the terms of the different commissioners, because what usually happens is we have it in the file, and it happens every year in July. We know there are certain people whose terms are expiring. And if that information is not available right now, we can get that information and have it available for the next meeting. Ernest, did you have a comment? Yes, we've got that information and I can send that to you tomorrow. Pam has it. So we'll ask for it and distribute it tomorrow to you. Oh, great. Thank you, Tim's saying. So we also have 2 vacancies. We have the need for 2 deaf commissioners. And we should fill both of those slots. We have talked about recruiting a diverse Black and Brown Indigenous people. And last week at the executive committee meeting, we had talked about how we could go about recruiting. Like if we went to the Rhode Island School for the Deaf, there might be a recent graduate from the school who's over 18, who might be interested. It'd be great to have youth involved, people who are 18 to 30, who are not used to being, you know, their perspective, we're not used to hearing. It'd be great to have them involved. And we'd like to also, we talked about other ideas about reaching out to the Alumni Association of Rhode Island School for the Deaf and see if there are any people in that pool who might be interested in becoming involved with the commission. So more outreach to try to recruit people. And Ernest, did you have other comments to add about that? Yes, I did. 1 second, I'm just looking at something. So it is difficult to recruit people for these slots. I have reached out to people and they're not willing. They're not ready or they're not comfortable. And as I've said before, in this environment right now, there's a lot of negativity. What happened at the Registry of Interpreters for the Deaf, the board, most of them left. And there's a lot of racism and autism. And I think that right now it would be very difficult to recruit commissioners because of the issues that other people are facing who are serving in leadership. If we could maybe get the sense of the community to get a sense of who would be available, what would be people would be interested in, make them more comfortable in stepping forward. I'm thinking, you know, and especially like face to face, I think that's another challenge. Like somebody who actually can come and be committed to coming. Oh, I see Amy's comment. Amy Slezak is saying, can you explain why RID is related to the comments you just made? She's curious. Okay. And the Registry of Interpreters for the Deaf, RID, which is a national organization, what happened in the most recent history, the president of the board, Jonathan Webb, Dr. Jonathan Webb, and now I can't remember, I think 2 other board members, those 3, what happened is they won the election for the next term, which should have been starting, and people in the community were complaining about that and challenging the results of the election, stating that because these people can hear, that it was a result of autism. From the perspective of the board, who these particular people were people of color, they felt like they were the victim of racism, and that the reason that people were opposing their election was racism. So they actually removed themselves from the RID board after having won election. So there was another, I'm trying to think, now I can't remember even how many people. I know the president could have continued because he won the election, but he stepped out of, so there's going to have to be a special election now to re-elect the president. For the most recent information, I don't know when that special election will occur. And so right now our RID is in crisis. With the other 2 officers, I don't know if both of them had been elected yet to continue the term, or they were just finishing the terms that they were originally brought in. But anyway, all of them, they had the RID conference very recently, and all 3 of them had resigned just before. And if I'm incorrect on any of the information, please correct me, because this situation right now with the 3 of them, Ernest, I didn't know if that was your, your point. And I see Amy is still making a comment about impacting RICDHH and recruitment. Okay, thank you for clarifying, Tim. Yes, and Amy's question is, it's a good question, like how will that impact RICDHH recruitment? So what I think is a lot of people all over are seeing this happening with issues with in the social media with people of color, with BIPOC people. And I think that it's a sensitive, I think people feel like, how to say it? It's hard to explain, but do people feel like it's worth being part of a leadership group if they're going to be treated like that? If people are going to put them down because of racism, then they're not going to be interested in being on a committee or a commission if they're the only Black person or the only Black, Indigenous, or person of color. So that affects those people who left the RID board. I think that that's going to affect people's willingness, that people weren't allowing them to do their job. They got elected, and to see how it goes. And instead they were being contested, and as a result of racism. And I think that's going to affect people, Black and brown communities, their emotional reaction. Like, are we comfortable? Are we going to invest our time and energy if the result is that we're going to be put down and overrun by by racism. That's why I feel like we need to set up a forum to talk to the community and find out how they feel and how can we help? What are their issues? How can we partner with them? And I think right now it's going to be a very difficult process. I think it was already difficult, and because of RID, it's even more. We had last summer racial reckoning, basically, and there are so many conflicts and divisions within the community. I know RID isn't specifically connected to RICDHH, but what happened there, people are seeing that. And I feel like it is going to affect us because people are going to be thinking, is it worth me putting myself forward if I'm just going to be slammed? So does that answer your question, Amy? I hope it does. And I see she's saying, thank you. I can see this needs a lot of discussion. I hope we can have a forum. Tim is saying, as I have served on the commission, this is Tim speaking now. I was quoting Amy's comment, but now I'm speaking for myself. You know, we have these 2 vacancies, and I want to make sure, you know, that we make a real effort to reach out to people to fill those 2 slots. And this is where, you know, when we have to really look at where we are now and recognize that if people coming forward, if it's only one person who's BIPOC, that's not representative. And we need to actually give people the skills and the leadership training so, you know, we can give them the benefit that we, you know, so that they can move forward into leadership. I think that we need more representation. So it is a challenge. It really is a challenge. If there's any more discussion on that, and we're going to switch interpreters.
Anyone have any comments to make? Any questions or concerns? I know we have 2 weeks. Yes, Betsy?
I guess I'm just wondering, you know, how to outreach and maybe do an extra step of outreach that we haven't done before. The person I know the best was a member, a Black minister who had hearing aids, and he on a couple occasions contacted me and we talked about using hearing aids. He's in Atlanta now, so he's not a good contact, but I'm wondering if, you know, reaching out to communities that may know of people who might be interested. I don't know if it's the Council of Churches, the Urban League. I don't know who it would be, but I'd be willing to help think about how to do the outreach with a few other people, if that seems like a good step.
I think it's not even just the RI commission, but just other organizations around. They're also facing the very same challenge as well. I know that I'd have to say most Black and Brown individuals that recently graduated from Rhode Island School, you know, they're young, they have potential, they have that a particular, you know, they're youthful, they're new, right? So I'm just thinking about what kind of opportunity of training, leadership support we can give to them. I don't know, there's a lot we can discuss in terms of figuring out how to draw them in. There was a comment from Amy Slezak, who's saying, what about connecting with a social media marketing person? I'm sure there are some BIPOC that are majoring in marketing and could help with ideas and creativity. That's the comment from Amy. If others have more comments or ideas, I welcome them. I also think that we have to continue this discussion as well. If there's no other comments or discussions, I think we can move on, but I think it's definitely a conversation we should continue to have. And I just realized Ernest made a comment in the chat box saying, thank you, Amy. That's a very good idea. We can research this more. So just in the essence of time, this is a very important issue, and I do want to have more conversations around it. That's something we can actually add to our strategic goals that we will be discussing, figuring out basically how to do this. What's the approach? I mean, we don't have all the answers right now, obviously. We're all in conflict and trying to figure things out, but I think it's important that we continue to have open conversations about this and figure out what our plans and our next steps will be. The next item is co-chair and transitioning that. It's been 6 years. And so I'm hoping that I don't want to break the record of having 2 co-chairs 6 years together. So I think 6 years for any leadership position, that is the cap. I believe after those 6 years, the energy starts to wane. I know from my work commitments, I feel as though it's a good time to transition out. So I'm open to anyone here who, any of the officers, if they're willing to continue, or if they wanted to transition out, step down from your particular officer position. I think right now is a good time for us to start having those conversations in terms of nominations and planning for our next fall, or I would say August, September, October, more so September, for elections. August, we'll start the nomination process. And right now, I just want to put that on the table. If anyone has any interest in becoming an officer, becoming a chair, there are 4 positions. If anyone's interested, have any thoughts or questions even, if you want to learn more, we should start that conversation so that we're ready for that transition. So right now I want to open it up to the floor. If anyone has any thoughts, again, any discussions, before we move forward in the month of August with nominations and transitioning to the new officers. Caroline?
So it's not a matter of stepping up. I think it's time for me to step down from my position as vice chair. And I also think, I don't know when my term is up, but I think this might be a good time for me to leave the commission, because I have been here 7 years and I know what Tim means about beginning to lose energy. So I think it's time for some other people to join the commission.
Betsy? Thank you, Caroline. Betsy?
I'd just say that I'm on the fence, but I think it would be good for someone to be like secretary in training. Carolyn's helped me from time to time with the minutes. I kind of can't believe I've been doing this because I am a 3-finger typist. I'm a very slow typist. But I think I do it well, and I can definitely train somebody or turn it over to somebody.
Yes, Brett?
Yeah, I think I started to bring it up in last week's executive meeting as well, but I'm probably in the same boat where I'm considering leaving the commission as well. It's just I have a lot of other priorities I need to focus on, and just the last year kind of just took a lot out of me. We had a lot of meetings and a lot of job changes for me, a lot of life changes for me as well. So I'm probably in the same boat, unfortunately. All right, thank you.
Betsy,
Yeah, I just think this is something Shane can help us with. It sounds like, you know, the people that are really knowledgeable and have been on the committees and been working hard are maybe the people leaving. I think that's a problem. I think, you know, so.
for those individuals who are thinking about leaving, please give us time for transition to be able to have people join the board and we can then transition them in, because we don't want the boat to sink, right? We want to make sure that people are still on the boat and then we can actually have people who want to step off the boat, come on the boat, right? We don't want the boat to just sink in the water if everyone just jumps ship at the same time. So those are, I believe, people are going to continue in the next chair, and then making sure, again, they're being supported and then transition over to them that role. And I know if I'm residing as chair or a committee person is continuing, then we want to make sure that the term is completed, then transition is smooth. We just don't want everyone to, like I said, jump ship at the same time. And that's my particular role. I know as a chair, I want to make sure I find the right person to fill my shoes. So obviously that's just something, again, Shane, once he's on board, he can work with that in terms of outreach, training, transitions in terms of new board positions. Does others have any comments or questions about that? Yes, Brett?
Without really knowing the history of the commission and how often you guys work with the Governor's Disability Council, I don't know if there's an opportunity to add a share over there, so that way we can kind of have a voice there and kind of like we act as a subcommittee of it. I'm just trying to brainstorm different ways. But like I said, I don't know the full history of how the state had managed this commission whenever there was a lot of transition going on.
Well, I'm wondering, do we want to have more discussion around this? I know we have a few more items on the agenda. They're quite brief, but I wasn't sure if people want to continue discussing this. Christine West, if you're still here, can you come on and share about the Interpreter Week for the Public Health Equity Interpreting Program, the events that are happening on that week of August 15th?
Sure, thank you, Tim. Well, we're just about there. We're kicking off the Public Health and Equity Sign Language Interpreting Program. It's actually becoming a reality. This is something that we've been dreaming about for a long time in this community, and it's finally happening in just a few weeks. So the program consists of a hybrid format. So there's a 1-week residency here in Rhode Island. And then after that, participants return home and the rest of the program is conducted online for 9 months, starting in mid-September until the end of April. So during the week of August 15th to 20th, we will have participants from all over the country who will be joining us here in Rhode Island for this 1-week residency, and we're thrilled about it. In addition to the day program that they will be participating in, we also have a night program as a companion to that. And the night program is open to the community. And it starts on Sunday, August 15th. There's a kickoff reception that will be taking place at Hotel Providence in downtown Providence. And we're hoping that commissioners will attend. There'll be hors d'oeuvres, there'll be a cash bar, and there'll also be an ice cream sundae bar as well. This is open to the community, and we hope folks will come out and meet the first cohort for this program and welcome them to Rhode Island. We are expecting that there will be some state officials who will be joining us that evening, so we hope that commissioners can join us to represent the agency. Monday through Thursday evening, there's a series of lectures or panel discussions all relating to health equity, and that is open to the public and open to the community. And we hope that folks will come out and join us to participate in those critical conversations about health equity. On Thursday, which is the last night of the evening events, at 5 o'clock, there will be a community barbecue at Rhode Island College. And again, that is open to the community. We hope you can come join us and participate in that. Free food, fun, socializing. More information will go out on Monday. I'm hoping to confirm the calendar by the end of this week and hopefully get that ready for next Monday to announce. And we're looking forward to an eventful week and an exciting week, and just looking forward to welcoming this first cohort. So.
Great, thank you so much, Christine.
So the month of September, we have Deaf Awareness Month. And there will be some events and information. Pam Zellner is arranging that. So she'll be putting anything that you suggest to her on her calendar. And Ernest, if you have anything to add about Deaf Awareness Week and things that you know are happening, right? Ernest, if you're here, if you could pop open your video. Hi, Ernest is saying, I'm sorry, I'm doing that now. I don't think Pam is here tonight, but if you could talk a little bit about Deaf Awareness Week, month, excuse me. Yes, we actually had a meeting about it last month. And we're talking about emergency preparedness awareness and coordinating some of the events so that access is involved in the panels and the workshops. We'll invite people from different organizations to speak about their programs and what they're doing in their programs. And Pam and Michael Bear are working together on making sure that that information gets out to people. So the commissioners will get information on that very, very soon. We're working on it. Thanks, Tim Singh. Okay, the next item is in November. We have the coffee hour. And I know, Ernest, you already spoke about it. There's been some plans about the event. And maybe if there's any items that the commissioners can put out about themes for our 30th anniversary coming up next year, and guest speakers that we could bring in, and awards, how we're going to do awards for the coffee hour, because it usually is that the community sends us nominations for people to receive awards, and we discuss those and vote so that we award those to recognize their work in the community, their advocacy, and other things that you know, usually the commission deals with that. It is now July and November is coming right up. So if there's anything that is needed from us, we should discuss that so that we're ready to vote. And I don't know, Ernest, if you had other information or anything that you know you need from us as the commissioners. Ernest is saying yes, one moment. So I do want to ask the commission to give me ideas about the coffee hour itself in November, the theme, what we should be focusing on. Because what we want to do is make sure that the speakers and the awards are appropriate related to the theme and make the event more enjoyable for people, to make it more worthwhile. And also, we talked about a hybrid format, that we would have the speakers and the awards through Zoom, and then people gathering in person at the very end of the event, so that we would have exhibit tables. And we would like to get a sense of what the vision is for that coffee hour. And as we're going to be kicking off our 30th anniversary, it'll start a full year of celebration that'll go till October of 2022. So that period when people are getting awards and we have speakers, and then the gathering, the social gathering of people all together, will start that year celebrating. So people, if you could pass on some information to us about what you're interested in, and Pam and I will be continue to work on that. And Tim saying, thank you, thanks. So one thought I had, Tim saying, with fiscal year 2021, and now we're in the new fiscal year 2022. This is going to be it's a big year that we are setting up this interpreter program. We're talking about health equity. And I'm wondering if the theme could be celebrating that. And at the same time, there are many people who were ill, we've lost in the community due to COVID. And I think we should memorialize them. We should be having some remembrances of them. And in November, we can't even predict that COVID will be completely over with all the new variants. So we could have a celebration, but I also would like to have some memorial. We've lost leaders in this community due to COVID and due to other illnesses. And I would like to get some ideas to discuss about, to throw out some thoughts. And I'm open to anything that people want to share at this point. Betsy, yes.
I think we created lots of things in the last year. We had more meetings than any other year. We created access to information about COVID, access to the vaccine. We created webinars on about 6 different employment topics. We got the interpreting program started at RIC. It's almost like it was an interesting year because it was so challenging health-wise and connection-wise, although we made Zoom work really well. So it's almost like I agree. It's almost like we need to just assess what we've done and where we're going. I think we've built a lot that we can be proud of. There's not just 2 things, there's like 6 or 7 things. It's the first long board retreat that I've ever been on, and I've been on the commission a long time. So I don't know, connections, celebrations, and remembrances. How about that for theme title?
Yes, I'd like to hear from other people, commissioners, if you have comments that you'd like to make. Any other ideas? Do you support the ideas that have already been spoken, or you have some revision to the ideas that have been spoken? I'm open to hearing whatever. Caroline, yes.
I very much like the idea of memorializing people. I think that's important. But I also think it's important to consider what we're doing now and then look to the future. So, you might call it past, present, future. Just a sort of an offshoot of Betsy's idea.
Yeah, thank you. Others? it seems like there's a sense of a theme, looking at the past, memorializing, and then celebrating our achievements and our challenges, even though it was a very challenging year. And then what's next? And I think as we start to think about the 30th anniversary, this organization has been 30 years in existence. What's the next thing for us? So that might be the idea, those three. And if you like those ideas, maybe we could move forward. Somebody could actually make a motion towards those.
So I move that we adopt the theme of memorializing, celebrating, and looking to our future challenges and goals.
I second Kimmy saying. I see Kimmy Marler's yes, seconding. Discussion? All right, then we could vote. Anybody want to amend the motion on the floor or speak in support or opposition to? If not, let's move forward to a vote. Let's everybody open up their video and show thumbs up, thumbs down, or you're not voting. Okay, I'm going to count people. I'm seeing 7.
Yeah.
And I think Tina left. She had to leave. I see that she posted something in the chat. So it passes because it's unanimous among the people who are here still. Thank you so much for that discussion. And the other is still related to the coffee hour. And thank you for your patience with this long meeting. We'll be over soon. Is awards. So I have put out the information usually to have the community fill things out, send it back to us. And I don't know if we want to do that process or if we have a different approach this year. And I'm open to any ideas. What we've done in the past, usually in July or August, we stop posting the information within our emails, social media, and letting people know that we're looking for nominations. And we usually have several people, 2 or 3 people will send us comments about a person. We'll get to, sometimes we have somebody in mind, but nobody's nominated them. And I'm wondering if because of that, we could be more inclusive and actually identify people who are very often overlooked, who are really working hard, but maybe behind the scenes. And I'm wondering what your ideas and thoughts are about that, about whether the commission should be more proactive. Yes, Betsy. Oh, I saw you for a second. There you are.
Oh my gosh. I would love to give something to Paul and Margaret Malloy. Paul posthumously, and Margaret is just ever present and has worked for a long time here in Rhode Island. She's connected with my organization, HLIA. She's worked for OSL. So, if we only do that, I would be very happy.
Good. Yeah, thank you. Thanks for your comment. Any others? Ideas about how we would move forward with identifying people, the finalists? Usually we have them by September, we would know. So we've got about 2 months ahead of us. Am I thinking right? No, October gives us some time. So, we want some lead time to be able to prep, but we should put out some blogs, social media, do some advertising Do we want to establish a committee, maybe 3 or 4 people to try to collect names and document reasons for picking those people and nominating those people? I just wonder, I mean, we could do it ourselves as well as the commission. I'm just curious what people's thoughts are about how much to engage the community and how to do so. Yes, Bunmi.
Will there be a criteria for nominating people for these awards?
You know, in the past, we did have a list of criteria. There were 2 different kinds of awards. And I think it's pretty flexible. I mean, we could come up with new awards this year, or we could revise the awards that we've given in the past. I feel like, I mean, tomorrow Ernest is going to be sending out information about the terms of the officers and the commissioners. I'm going to look for that paperwork and send that to Ernest, and he can share that with all of you and you can review it. It has the criteria on it. And if you want to keep that the same, one of them is called the Legislative Award. And that tends to be an award that would go to a person who has been very active in helping pass new laws and a strong advocate to change the system. And the other, I mean, that person, it could be somebody who works in the state, a person who's a city council member, a senator or House of Representatives. It could be anybody who works in government as a leader and should be recognized for the work that they're doing to change the system to make it more equitable for deaf and hard of hearing people. And the other award, I'm forgetting exactly how it goes. I'll look that up, but the first one is legislative. The second one, I think we call it a citation rather than an award. And it tends to be more like commending someone for the work they're doing. And we want to see them continue, giving them positive input, like, don't stop. We like what we're seeing. So the recognition is not the same as an award. It's just recognizing them for what they've been doing. And then we've also given gift certificates to people who have finished service on the commission. We tend to give gift certificates, and we would do that during the coffee hour, just a show of appreciation. And Betsy, I don't know, maybe Caroline, one of you who remembers more about that I'm forgetting about the November event, and we're going to switch interpreters.
Betsy?
I guess I would be in favor of getting input for the community. And Pam has all the criteria, like what Bumi was asking for. And she has, the form that people in different organizations can fill out about their coworkers or people they think are doing really well for deaf and hard of hearing people. I think I would like to try to get some community input. But, ultimately it is the commission's decision. A lot of years, the legislative award hasn't been given. That's kind of, it doesn't happen every year. And the other award is, see, that's why, like all of this is like at Pam's fingertips. If we could just have her send us an email, then we'll know the names and the criteria. So.
I'll take a look. I'll do some research and then I can send out the details tomorrow. I'm also thinking, do we want to go ahead and start advertising now, or do we want to give us more time? I'm not sure if there, I mean, I know we have no meeting scheduled in the month of August. I think the first week of September is the next meeting. So that would mean that we'd have to wait until September, which is kind of cutting it close. So I'm just thinking, do we want to go ahead and do some advertising now as soon as possible? I mean, it's really up to you all. What should we do? Go ahead, or do you prefer to wait and hold off until September, our September meeting? What are your thoughts? Caroline?
I think we should probably hold until September. I also can't really imagine who we would give the legislative award to this year, since it feels like we really had no contact with the legislature. So those are my thoughts.
Thank you, Caroline. So do we agree with what Betsy just mentioned, that we should hold off until September? Anyone else want to chime in? Seems like there's some silence. So I think we'll make the decision to hold until September. What I'll do is go ahead and send out the 3 different awards, their criteria, and I will definitely make sure that it's sent out to everyone. The last item, I wanted to open this up for discussion, is around if there are any important ideas or agenda items we want to discuss at future meetings. Perhaps maybe we want to invite a special guest or stakeholders to come to our meetings to give a presentation. I wanted to open this up so that we can be able to be prepared for our next September meeting in terms of what our agenda will look like. Any thoughts that come to mind in terms of individuals we want to invite? Maybe they can talk about their particular organization or any kind of hot issues that are out there in the community that we need to be aware of. I thought that it would be best for us to open that up to talk about. And also, if there's anything that individuals feel that is quite critical, go ahead and email Ernest, and that's for the future meetings, and he can add that to the agenda. And then I will get a hold of that, and I'll figure out when and where to put that on the agenda. So just let Ernest know if you have any critical topics. Betsy?
I'm a little bit in favor of waiting on this until we figure out how easy or hard it is to meet in person. I think we need to practice meeting in person for a meeting before we invite a guest. That said, there were a couple people mentioned last time. I could look at my notes and tell you who they were. I thought they were good ideas. I know one was James Litvack to talk about technology.
I'm sorry, Betsy, can you?
It's Litvack, V-A-C-K.
And oh boy, I have them. I think I put them in the minutes, actually, the name. No, I didn't. Think of it. But I could go back and look for the names, and I'll send them to Ernest. We had like 3 or 4 ideas, but I'm a little reluctant to invite people until we know that people are going to drive to the location and they're actually, it's going to be interpretation, and how hard is it going to be for us to transition our meeting?
Thank you, Betsy, for your comment. Others want to add? I mean, if there's none other, I think it's important for us to be mindful that if, you know, again, if there are any ideas that come to mind that you want to add to the agenda that you think is important, you can always reach out to Ernest and he will, again, share that with me. Yes, Ernest? Yes, so whatever information I get, I will share with everyone just for the sake of transparency, and Pam, I will also email as well. I wanted to ask you, the meeting on September 8th. I know that, are we still meeting on August 18th? And actually, excuse me, are we still meeting on August 18th? Are the interpreters all set? Or are we skipping that meeting? And are we going to go ahead and cancel the meeting on the 18th as well as the interpreters and the CART reporter? So are we actually having a meeting on the 18th? And Ernest is saying, I remember that we had voted all individuals, we had voted to have a total of 8 meetings for the year. And so I just wanted to ask if we were going to go ahead and cancel the meeting on the 18th of August, because if that's the case, we need to let everyone know, and that we'll keep the meeting on September 8th. So it's up to you as the chair. So that's the same week. So, yeah, I mean, how do the commissioners feel? Is it important for us to go ahead? I think it's important for the community to go to the events during that week of August 15th, right? There's a lot of events that are happening that night. So I want the commissioners to be able to be available to attend. And Ernest is saying, I agree. I think we can go ahead and cancel August 18th, the CART reporters as well as the interpreters, and then we can keep the meeting on September 8th. And this is Drew, I agree. Those events are happening all week and they're a hot topic, right? They're a priority. I think people should go. I want to make sure that we have less meetings so that people can actually go, like Betsy said. I think it will be helpful to know exactly what the meetings will look like in person, right? So we can prepare for that instead of us just kind of moving forward just because we have a date in mind, right? So I think we should go ahead and cancel the 18th meeting and have the meeting on September 8th. So I'm just wondering, this is Tim speaking. Do we want to go ahead and cancel the August 18th meeting and then we'll go ahead and start fresh on the 8th of September? Do people agree or disagree? Anyone oppose? Any objections to us canceling that meeting on August 18th? Anyone? Seems like there's no opposition. And so we'll go ahead and cancel the meeting on August 18th, just because we do want to give our baby, our program that has just been birthed. We want to make sure, we don't want to just go forward with the meeting on the 18th without recognizing that we wanted the community to go to the events on the 18th for our program. So with that being said, we have 5 minutes left. Are there any last minute announcements? People want to share information? As I mentioned, David Mahoney, his last name, the interpreter missed, but David Maloney, thank you. David Maloney gave birth to a newborn baby, so we want to send congratulations to him. Any other announcements? If there are none, then we'll go ahead and adjourn the meeting. We will adjourn this meeting at 8:57. Thank you for your patience. I know meeting before, was canceled, so we definitely had to fill our agenda to make sure everyone was caught up. So I want to say thank you again for your time and have a great night. If we all can come on camera and say goodnight to each other. Great, thank you, everyone.